To welcome Dr. Sharif El-Nahal. Dr. El-Nahal is a longtime supporter of innovation, having co-founded the Diffusion of Excellence during his first tour at the VA as a White House Fellow. As our Undersecretary of Health, he continues to be a fierce advocate for frontline innovators who are improving the veterans' experience across our enterprise. So, round of applause.
Good morning and welcome home, innovators. How are you? It's great to be here. I want to first thank the incredible organizers of this event, Dr. Carolyn Clancy and her leadership, Dr. Susan Kirsch, Beth Ripley, Kit Teague, Blake Henderson, Madison Coffey, so many others who helped make this happen today. And I just want to remind folks that, me and somebody named Andrea Ippolito a number of years ago had an idea to combine the awesome work that was already happening within VHA with the incredible Spark Seed Spread work that she was just in the phase of ideating and had just launched her initial class of innovation specialists throughout the healthcare system. And we said, hey, we should probably work together and combine these things and make something awesome. And we did that, and it has since grown and proliferated and gotten us to a point where we're here with now hundreds of people in this room who are constantly innovating and looking for the next best solution for care delivery to veterans, enhancing our care every single day, and offering best practices for the rest of the system to scale that work. And I know the Secretary was here yesterday talking about the importance of innovation to better meet our core course requirements every single day for veteran care. And so the most important group to thank is all of you, the innovators, the developers of best practices, the folks centrally in the innovation ecosystem who are consistently working to make those solutions available to everybody. So please give yourselves a round of applause for the impact you're having on vets. I was asked to talk about a really important thing, which is on top of what the Secretary was speaking to all of you about yesterday, what the impact of innovation is on the daily experience of our employees. And it often goes unsaid that happy employees mean happy patients and happy veterans. That's in fact the only conduit we have to improve the veteran experience. It's through our frontline employees. And so any harebrained idea that I have or our subject matter experts have in Washington has to go through our multiple channels and end up in the hands of an empowered workforce on the front line. And so if you're not thinking about whatever you're developing in the way that it is experienced every day from our incredible now 408,000 person workforce across the system, your innovations are going to fall flat and your best practices are going to fall flat. And so what we do with mechanisms like Shark Tank is we pressure test whether solutions are actually solving important problems and whether they actually work. And so I really look forward to participating even in some small way to the Shark Tank later this afternoon. But we know that that important channel goes through our people to meet veterans. And so I want to talk about one of our incredible employees. Her name is Billy Slater. She's a prosthetic sock management tool specialist. Is Billy in the room today by any chance? All right. Okay, go ahead and stand up if you can. All right. Billy is from Minneapolis. Are you a Vikings fan by any chance, Billy? I'm sorry about that. But you've got a lot to be proud of nonetheless. Billy was a full-time mom for 19 years and before her career at VA. And then she joined VA as a bench scientist. Throughout her career at VA, she exhibited hard work and commitment to our nation's heroes. And she did so despite having not had the opportunities to pursue an advanced degree beyond the degree to which she was able to achieve, which was a master's in education, despite having wanted to do that throughout her life. One opportunity, though, gave Billy the chance to spread her incredible work across our great system. And that was a flyer that she saw one day about the Innovators Network. You said to us, Billy, that you thought, quote unquote, this is my chance. At the time, you were working at the MAID Center, also known as the Rehabilitation and Engineering Center for Optimizing Veteran Engagement, as part of the Minneapolis VA healthcare system. And as part of your role, you regularly attended the amputee clinic and noticed a recurring problem that veterans were facing. Really important prosthetic socks, which allow for the healing ultimately of wounds and overall gain of function over time for veterans. The socks that they wore with their prostheses were not often worn correctly because veterans did not know how to use them. And there are different types of socks with different thicknesses used at different times of a veteran's recovery process and integration with their new prosthesis. But wounds had trouble healing, and other negative health outcomes were resulting because veterans did not have a full understanding of how to use them. And Billy, being the very veteran-centered worker that you are, recognized this. And like so many of our innovators across the system, she said, you know what, I'm going to do something about it. Not necessarily when anyone's looking, not necessarily to get an award, certainly not necessarily for the big bucks in the VA healthcare system, but because she cared about veterans. And so she noticed three problems. The first is that veterans did not know what socks to wear and when they should wear them in their recovery process. The second is that they didn't know how to check their comfort level and report that comfort level to her clinical team to make sure that that veteran is served. And the third thing is that they weren't always necessarily using a clean sock. So when veterans would come in, for example, a veteran might say, you know, I've tried this sock for many days now and it's not meeting my needs. And then when the veteran comes in and she says this to our team, they're like, well, wait, you should really be making sure that you use a clean sock. It's part of the healing process. And so Billy's solution was pretty simple: to have a sock organizer with a well-developed infographic explaining to the veteran or their caregiver what proper sock management looked like. Simple solution, solved a very veteran-centered problem, not high-tech, but important, because it solved a really important veteran-centered problem. And so now this is standard across our system. The prosthetic sock management tool is helping veterans across the system with prostheses get through their care journey. And a senior research study coordinator today, Billy tells us, through the development of the PSMT, I learned that I was not just a task doer, but also an innovator. I saw myself in a light and have been inspired to bring this exciting possibility of transformation to my VA colleagues. Please give a round of applause to Billy for incredible work. I'll also talk about a couple of other employees who are making strides in innovation and how that's leading to better veteran outcomes. Employee well-being itself is a really important goal that we have to achieve for the reasons I just mentioned. And Barry Peterson at the VA Sierra Nevada healthcare system was taking a closer look at creating psychological safety at work. Barry, if you're here, please raise your hand and stand up. Not with us today. In absentia, I will say that Barry, creating this culture of safety, was empowered to speak up and raise issues to create a more positive work environment. And during COVID, the Innovators Network produced solutions to address employee burnout and improve well-being, including employee well-being centers and CARTs, led by Adelina Soul out of the Biloxi VA Medical Center. Adelina, are you here today? Stand up and please be recognized for your awesome work. The Employee Wellbeing Center was initially piloted, and a temporary space was ultimately modified for employees' use also at the Orlando VA Medical Center in response to what we had to do during COVID-19, which is to create labor pools of employees to fill in jobs where needed across the system, even if that was not their day job that they were trained for. And so our teams knew that well-being carts and well-being rooms were the right thing to do. And it started with VA employees themselves recognizing that when you care for our employees, they can better meet the mission for veterans. Let's talk about VA Immersive. Evan Davis, where are you? You in the room? All right. I had a chance to record a podcast recently with Evan and also to present at a Digital Health New York conference. Evan is a Marine veteran who became a recreational therapist shortly after his military service, after he was transitioning, really building from his awesome experience in the military and the training that he was able to garner. When he came into the VA, he came in right when the pandemic started. And so recreational therapy traditionally requires the veteran to be in front of you in person, to be able to deliver the true value of that therapy. And so it was a big bummer for Evan to come in and then most veterans staying home and getting telehealth in lieu of in-person care. So ultimately, it's unclear whether Evan was going to make an impact. And so somebody is pointing over here. If Evan, you're over there, if you could stand up. Oh, there you are, I can't see you. Awesome. So he decided to push the boundaries of what was possible. And he learned about what the innovation ecosystem was doing in virtual reality and extended reality and said, you know what? I could probably do what I'm doing through VR and XR. Evan effectively created the way you can provide recreational therapy with new technology in a way that's almost as impactful and in some cases potentially more impactful than having the veteran in person with traditional therapy. And so I just recorded a podcast with him and 2 veterans who benefited from this. Both veterans were having trouble sleeping. One veteran had significant mental health comorbidities, but was able to get the experience of being in serene environments like a beach, like fishing. The things that relaxed these veterans were able to be reproduced in a virtual reality environment, and Evan could apply his incredible expertise to help them. And so veterans were telling us about this on this podcast, and it was an incredibly fulfilling story. But if we didn't spend particular attention in empowering our frontline recreational therapists like Evan, who is now part of our incredible infrastructure on virtual reality and extended reality and clinical innovation with technology, then we would not have been able to impact these veterans' lives in as meaningful as a way as we have. So a big round of applause for Evan for what he's done. The VA Immersive team has now spread virtual and extended reality to more than 100 medical centers across the country, has now distributed thousands of VR and XR headsets with a really ambitious goal of reaching north of 10,000 to have veterans take these home. We're having conversations with IT now on whether we go even higher and say, hey, we're handing out a lot of iPads, but guess what? This is really cool equipment that can have really impactful care delivered through it with our clinicians and experts across the system. And the impact of VR and XR is only beginning to show itself when it comes to veteran benefit. I want to also talk about our incredible Office of Advanced Manufacturing. We have somebody named Bill who runs our 3D printing lab at the VA Northeast Ohio Healthcare System in Cleveland. Bill, are you here? All right, my friend. So in Cleveland, they make anatomically corrected 3D printed patient-specific models to help surgeons plan for complex surgeries and explain the procedures also to veterans and their caregivers. So what does that mean? We're taking patients' anatomy and building 3D printed models and showing the veteran and their caregiver and family member exactly what the surgery is going to be about. I would have killed for a tool like this when I was on my surgery rotations, back-breaking stuff when you're a resident and a medical student and a clinician. And it's oftentimes hard to explain what's going to happen to a patient during surgery. It's almost always a black box for them. And it's really fascinating how much explaining what's going to happen eases somebody's tension, even though they know you're going to be all up in their insides and guts. They at least know what you're doing and understand what the goal is of the procedure. And that has an incredibly relaxing effect for a lot of patients. Number one, that the clinicians care enough about their understanding of what's going to happen to explain it to them and to be able to explain it to them with a 3D printed, customized anatomic model of what their body looks like and what their body will look like before and after the procedure. And I would really caution folks to not discount how much a patient's understanding relates to their recovery and their outcomes after procedures and after interventions. So our Office of Advanced Manufacturing is not only helping surgeons explain what these procedures will be like, it is also tangibly allowing for a surgeon to know what to expect in a 3D way before they enter the body. And these are things that surgeons are trained to do with 2D images, but imagine the power of a 3D printed model. Even more precision and even more that's possible with this great technology. So thank you, Bill, for your incredible work, and please give him another round of applause if you can. Let's talk about SimVet. We have a model for every possible care environment you can think of that can be entirely simulated at near the Orlando VA Medical Center, and that's SimVet. SimVet can simulate a labor and delivery room. SimVet can simulate an emergency room, a trauma center, an operating room, clinics, inpatient units, ICUs. We are bringing that to bear not only with clinical training, which is the traditional role of simulation. We are beginning to use SimVet for testing of new technologies, validation of new technologies. And as we proceed through the AI tech sprints, which the Secretary talked about yesterday, we know that the solutions that we ask for from early stage companies in the private sector will have a place to be tested that's safe and consistent with the trustworthy AI principles that President Biden emphasized in his executive order that he signed on Monday of this week. Ask yourselves how many other health systems have an entirely simulatable infrastructure to be able to test the possible impact of Gen AI. I can't think of any. And we know that while there are incredibly promising aspects to AI in healthcare, some of which we're already beginning to see evidence of, we also know that the pitfalls and the risks of AI are pretty high. And I'm not just talking about Terminator 2, which I love, by the way. I'm talking about real known risks that we're already seeing in things like perpetuating implicit biases. ChatGPT was racist before those elements were corrected. And that's actually no surprise. When you look at the baseline technology of Gen AI, and this is me speaking entirely out of turn here, but what I understand is that these large language models are basically just the internet. And what is the internet? The internet is a manifestation of humans putting stuff on the internet. And you know what that means. That means the population's biases, the systemic racism, the real problem that we have with prejudice historically will be reflected in these large language models unless you anticipate that risk and you correct for it. And so we've already seen the potential pitfalls, and I think we're just seeing the tip of the iceberg on risk. But environments like SimVet and SimLearn will allow us to surface risks that we were not even aware of when it comes to this really promising field that's ahead of us. And I think that's incredible. I think we will be the health system identifying these pitfalls before anybody else because of our commitment to innovation and the infrastructure we have and all of you, but also because of SimVet in particular. Round of applause for the SimVet team, if you can. Today, the Secretary is traveling to Iowa, where he will meet our incredible team at the Iowa VA Medical Center. And the Center for Care and Payment Innovation is going to do a really important project on diabetes value-based care and experiment with how we might incentivize, through our own internal payment systems, better quality of care moving forward. Who's here from the Iowa City VA Medical Center? Anybody here from Iowa? You might all be there waiting for the Secretary to arrive. Don't blame you. But I am really excited about what's possible here. The Center for Care and Payment Innovation is where we can really start to begin value-based concepts for payment in areas where veterans need it the most. And so we know that this is a well-funded endeavor for a reason. We just announced this week that we are recompeting our third-party administrator concepts, contracts for community care. And where we can exhibit enhanced value internally, we want to reflect that approach with our new contracts. And by the way, that is by definition something that will impact veterans across the entire country. So I want to thank the CCPI team for the incredible work that you're doing. If you could raise your hand if you're in the room, and if not, just give them a round of applause for their incredible work. So I'll close here with the tech sprints. This is a really exciting endeavor, guys. The tech sprint mechanism is awesome. Challenge.gov is the place for any external organization, early stage companies, venture-backed companies, established players, contractors, whoever you are, can enter into a competitive competition that puts your solution against all others and tests those solutions within government systems. So when it comes to Gen AI, by definition, everything is new and everything else is relatively untested. So not only do we get to see what the potential value is with a several-week-long initiative that has our teams, mostly the teams in this room, supporting the testing and design around new solutions. Whoever wins this competition, we can just go right ahead and sole source those solutions after they've been customized and adapted and redesigned to specifics and workflows that our VA employees already use and blast it throughout the system. Our focus this year is clinician well-being and burnout. Our clinicians over time have spent way too much time behind a computer, behind a terminal, behind a piece of machinery, more than they are spending time in front of vets, more than they are spending time teaching trainees, medical students, nursing students, residents. And that, over time, has led to more and more burnout. Now, we're making progress on burnout, don't get me wrong. Our last all-employee survey showed a reduction in burnout symptoms for almost every type of clinician, which is great news, and frankly, not surprising because of the incredible work of the Reboot Initiative in identifying burnout and stemming it where we can. But the daily hassles with things like view alerts and clinical reminders and a scheduling system that sucks and so many other things that our workers have to deal with, We're dressing them in the longitudinal way with IT, but we know where we can put Gen AI overlaying on our legacy systems that don't talk to each other, that don't interface with each other, and certainly aren't designed for a good end user experience. We can empower employees to do what they love, which is being in front of vets and offering clinical care and their expertise to help those vets, as opposed to being behind a computer and doing rote work. So that's what this is about. Things like ambient dictation, a pretty damn good clinical note draft that comes out of just a computer listening to what that interaction is between a clinician and a veteran. Already technology that exists. Technology that allows you to synthesize and summarize outside hospital records, which is something every clinician has to do. Or internal records that could be pages and pages long. I remember getting 150-page long documents for emergency patients that were transferred to the Brigham when I was a resident there, and having to comb through them and do the Cliff's Notes myself on what the patient was experiencing, what their history was. Really important stuff before, prescribing medications that can be life-saving, but if you don't know the history of a patient, they can be life-threatening. And so a way for Gen AI, which is just really smart technology that can read language, interpret it, and produce something close to what a human would, that could be a life-saving endeavor for patients, and most importantly, empower our clinicians to bring more of themselves and eventually be more productive without leading to burnout in a way that ultimately benefits veterans. So this is a really exciting endeavor, folks, and I know that there are people from academia here, early stage companies, funders, alongside about 2/3 of this room who are our VA employee teammates themselves. But if we come out of this with actionable solutions that help our employees meet their mission every single day and allow them to do it without getting burned out and ultimately improving their engagement and satisfaction with their jobs, we could become even more of a leading healthcare system than we already are. And the fact that we have the convening power to do this, the fact that we have the most important healthcare mission in the United States, means that we can attract the best players to the table and not only get their solutions in, but integrate those solutions throughout the tech sprint process. It's endeavors like this, folks, that all of you are pursuing every day. And for me, I am so grateful for that, because all of you keep the veteran front and center in everything that you do. Some innovation functions fail because they're not paying attention to the right problems. I'm not worried about that with all of you, because guess what? The folks we're pulling up to do innovation are the folks who are in front of vets every single day. So you know the pain points. You know the problems. You know what we need to solve. It's up to all of you to identify the solutions so that I can use whatever perch and power and leverage that I have in lifting your work and spreading it across the system. And that doesn't happen without our Office of Healthcare Innovation and Learning, but most importantly, it doesn't happen without all of you. So thank you so much. I really look forward to being part of the Shark Tank, at least for a period of time later this afternoon. But I am so grateful for all of you in this room, and thank you so much for everything you do for veterans every day. Take care.